Hey everyone, my name is Dr. Jeff Peng. This next question I get all the time. What should I use to treat pain? Should I use Tylenol or Ibuprofen? Are prescription pain medications better than what I can get over the counter? What about a massage gun or a TENS unit? Let's talk about all of this and more. Now, if this is the first time you're watching one of my videos, my goal is to help each and every one of you live an active and healthy lifestyle. So if that's something you're interested in, please consider subscribing to my channel. Now, the American Academy of Family Physicians, as well as the American College of Physicians, have come together to give recommendations on the best and most effective ways to treat acute musculoskeletal pain. So the goal of this video is to dive into some of these recommendations and look at which ones you may want to choose. Recommendation 1. Use topical nonsteroidal anti-inflammatory medications as first-line therapy. Now, one example of a topical nonsteroidal anti-inflammatory medication is Voltaren Gel or diclofenac gel. This is available over the counter, which means that you can go to any pharmacy and buy it on your own without a doctor's prescription. You can apply it to any body part up to 4 times a day in order to treat pain. Now, diclofenac gel works particularly well for many painful musculoskeletal conditions, and once applied to the skin, the medication will act locally. It's going to help relieve pain, it's going to help decrease inflammation, all without the side effects of taking oral medications. These work especially well for painful conditions involving the hands, the wrists, the elbows, the knees, the ankles, the feet, and that's because all of these painful conditions are located just underneath the skin, and that's where the topical medications can work really effectively. Now, it may not work as well for deep musculoskeletal pain like in the hip or the back. Now, topical anti-inflammatory medications are an excellent, cheap, and effective first-line option. Better yet, there's almost no side effects associated with these because it really does act locally and doesn't get absorbed into the body. Recommendation 2. Use oral nonsteroidal anti-inflammatory medications or Tylenol to treat pain. Consider also using acupressure devices or TENS units to help relieve pain. Now let's talk about NSAIDs first. So while oral anti-inflammatory medications are generally safe for occasional use, prolonged use have rather significant side effects. They can damage the stomach lining and cause ulcers in the stomach. They can damage the kidneys, leading to acute kidney injury or interstitial nephritis. They can affect the cardiovascular system and increase your risk for a heart attack or a stroke, or they can lead to rather serious increases in your blood pressure. Now, with that said, when used sparingly, they are generally safe and they tend to work quite well, but you really want to avoid taking these medications for a prolonged period of time. Now, the other thing to keep in mind is that it is also very important to take the correct dose. And in the United States, the 2 most common oral NSAIDs are ibuprofen and naproxen. Ibuprofen lasts in your body about 4 to 6 hours, whereas naproxen lasts about 8 to 10 hours. So to get pain and anti-inflammatory effects, you're going to want to take 600 milligrams of ibuprofen 3 times a day for around-the-clock coverage. For naproxen, that's going to be 440 milligrams twice a day. Now, what about Tylenol? Tylenol or acetaminophen is strictly a pain-relieving medication. You want to be careful when using Tylenol because many over-the-counter medications also have Tylenol mixed into them. But as long as you stay under around 3,000 milligrams of Tylenol per day, you'll be okay. And so that comes out to about 1,000 milligrams 3 times a day or 2 extra-strength Tylenol tablets. And how about acupressure and TENS units? All of these are soft tissue modalities and are among many myofascial release techniques used to treat musculoskeletal pain. Trigger points are an extremely common cause of musculoskeletal pain, many of which can be addressed by myofascial release. Other common modalities include using a Theracane or a foam roller, and you can check out my video on trigger points to learn more about them and how to treat them. Recommendation 3, avoid using opioids. Now, I 100% agree with this and always avoid using narcotics unless absolutely necessary. There are so many side effects associated with this class of medications that we want to avoid using them if at all possible. Those are the recommendations from the American Academy of Family Physicians as well as the American College of Physicians. To summarize, always try the topical options first. It is by far the safest, and if it works really well in treating pain. Use the oral medication sparingly, and look into soft tissue modalities such as massage guns or TENS units. If you have questions about other types of pain control, please let me know in the comments below. And if you found this information useful, please consider liking the video and sharing with others. Thanks for watching, and I'll see you next time.